Good afternoon, everyone. My name is Jonathan Sullivan, and I'm the Vice President of Product and Membership Design at the National Quality Forum. Welcome to this special program on responding to the challenges around COVID-19. We appreciate everyone taking the time amidst this crisis to participate, and we hope it'll be informative as you face many of the challenges ahead. We're especially grateful to today's speaker, Dr. Leana Wen, for sharing her perspectives with us as an expert on public health and patient advocacy. Dr. Wen is an emergency physician and public health professor at George Washington University and former health commissioner for the City of Baltimore. She's also a patient advocate and the author of the book, When Doctors Don't Listen. Some quick logistics before we get started. We hope that you'll take an active role in the question and answer portion of the program. However, please help us stay on topic and refrain from questions or comments that aren't related to the information being shared today. We've muted all phone lines to ensure that unexpected noise doesn't interfere with the program. We will be taking questions both through the web interface and through the phone lines. If you are on the web, we're now displaying instructions there for how you can ask a question. If you are only on the phone and unable to see the instructions, I will prompt the audience when it's time for phone questions. At that time, you can hit *7 on your phone to unmute your line. And when you've asked your question, please mute your line again by hitting *6. And I will repeat those instructions again later. With that, I would like to turn it over to National Quality Forum CEO, Dr. Shantanu Agarwal, to kick off the program. Shantanu, you can hit *7 on your phone to unmute.
Thank you, Jonathan. Can you hear me?
Yes, I can.
Excellent. Well, I want to thank everybody for joining us in this, our second call, specifically focused on the national response to COVID-19. I want to thank Leana very much for her time. I know that it is difficult for her right now, taking time away from her professional activities and obviously, doing everything that she's doing at the community level. I've known Leana for quite some time. I think this will just be a wonderful session and hopefully bring to all of us this national perspective that certainly she's been developing. She's hanging out with folks now like Anderson Cooper and other people, and so it's just remarkable to have her perspective here on the call. So thank you again, Leana, and with that, I'll turn it back to you, Jonathan.
Thank you, Shantanu. Dr. Wen, I think your line is unmuted, and I've got a few questions just to kick things off here. So I thought we would start out today with getting your perspective as a former city health commissioner in Baltimore. If you were the health commissioner of Baltimore today, what would be going through your mind right now?
That's a great question. Can you hear me okay?
Yes, I can.
Okay, perfect. And I first wanted to thank you, Jonathan, and also Shantanu for your incredible work, not only around this, but just in general in medicine and in health policy. I mean, this is quite an unprecedented time. And I have talked to health officials all across the country, including the current health commissioner of my city in Baltimore, and I can only imagine what they must be or what must be going through their minds to your question, which is how can we face the onslaught of what's to come at this time that we could have predicted this in theory, but whether we predicted it and when it arrives here just is a totally different picture. I think everyone is looking at what is happening now in New York and thinking, wow, my city could and very likely will be next. So how are we going to be handling this? What are the measures that we can put into place now, recognizing that ideally we should have put into place a lot more planning beforehand, and we should have the testing capacity. We should have better public health infrastructure. We should have better social distancing restrictions. I mean, there's a lot of we should have had that we don't have now. But what are the urgent things that we have to do now to put into place so that our hospitals do not become so over capacity that we will face the situation in Italy and Spain and Wuhan and other places that are ahead of us in this time-wise, of having to choose between which patients get care and which ones don't. And of course, it's not only the coronavirus patients who have to be, who are faced with this rationing of care, but also those other patients, because as you all know, healthcare doesn't stop during a pandemic, and other patients may end up getting compromised care as well. So I think that's what would be running through my head. How can I keep the residents of my city as healthy as possible, and ideally out of hospitals? But if they did need hospital inpatient intensive care, what are the things that I would need to shore up with our healthcare systems so that we don't end up having, frankly, bodies piling up, not because of their illness, but because we simply didn't have the beds to accommodate them in the U.S. in 2020.
Yeah, it's certainly a lot there's so many aspects to this and a lot to be taking into account as you try to figure out how to deal with it. You know, our public health infrastructure is challenged to meet all these needs of our communities, even on a normal day. And COVID-19, as you pointed out, doesn't mean that those other needs go away. What do you see as like the near and long-term impacts in terms of public health priorities like prevention of other communicable diseases, chronic disease prevention, HIV, AIDS, and other sexually transmitted diseases, maternal health, youth violence, school health? I mean, the list goes on and on. What do you kind of see as being some of the near and long-term public health impacts of this?
Well, I think near term, everything else is getting pushed to the back burner. One, out of necessity, and two, because it actually probably does deserve to be the back burner for the time being. Although the necessity part, I think, is important to talk about because, as we know, local public health, state public health, and public health in general just has been de-emphasized because public health work is invisible, and it always ends up being the first thing on the chopping block. I mean, we've lost a quarter of our workforce in local public health in the last 20 years. We have not had an increase in public health funding despite the increase in public health needs. And a lot of people are now looking at this pandemic and saying, we should have anticipated this. We could have anticipated this. We have anticipated this. And if we had put in the money beforehand, we wouldn't be where we are now. We would still have a virus, but we would be able to respond to it in a much more agile, resilient fashion than we are now. I hope that long term, that this will be a call to action to invest in those priorities and to see public health as a national security issue and a general health and wellness issue. But I do think that all these other things that you listed are going to be on the back burner, and I do worry about the impact, in particular, on the most vulnerable who are already facing the greatest challenges and barriers to care, but what that might look like for them in particular.
Well, another topic that I wanted to bring up with you today is around the patient perspective on all this. You've written and spoken extensively about how patients can take control of their health to advocate for better care for themselves. From all that I've seen on the news coverage of this pandemic, COVID-19 seems like a patient's worst nightmare. You've got people not able to get tested, mandatory quarantines, isolation from loved ones, caregivers buried under layers of personal protective equipment, and worst of all, the possibility of being told that there's nothing that can be done for you as a patient. What advice would you offer to clinicians and patient advocates about giving COVID-19 patients a voice in their care?
It's such a great question and such a difficult one because the advice that we typically would give is dramatically different in these times, and I'll explain. I mean, you mentioned at the beginning about my work in patient advocacy. I wrote a book on this topic after my mother suffered a very significant misdiagnosis and ended up getting diagnosed a year later with what turned out to be metastatic breast cancer that by then had spread all over her body. And so I was her caregiver at the same time that I went through my medical training, and so had written this book about how people can be better patient advocates, including things like bringing someone with you to medical appointments and ensuring that the physician, the nurse practitioner, et cetera, has the time to listen to you. I mean, things that under normal circumstances are what you could do to advocate for better care, but just are very different. Actually, another point that I wrote about in my book is about the importance of a diagnosis, because a diagnosis is reassuring to people. Knowing whether somebody has COVID or whatever, right, it is reassuring and could change management. And so it's just interesting that we're in this position now where all of these factors that actually in normal times are better markers for us taking care of our patients and families just have to be changed. And so, during these times when currently we don't have enough tests, patients are being told out of necessity, I'm sorry that you have these symptoms and you want a COVID test. I understand why you would, but we don't have the test. So go home and self-isolate. We will never know if you had COVID-19 possibly. I mean, that's not really reassuring to someone. And I can certainly understand that person's frustration as well as the frustration of their family members. Because what if that person comes back and they live with young babies or older parents who are immunocompromised, and what does that mean for them? I mean, that's very challenging. And then you were mentioning also about the changing hospital guidelines, which I want to reflect on. That, I've always told patients that they should bring a loved one with them, even for routine appointments. But that's totally changed in this world where I'll give you my very personal example. Actually, one of the reasons why we scheduled this call on short notice is that I am 39 weeks pregnant with my second child. And my hospital, they have a standard policy. They used to have a standard policy where they encourage all family members, as many as you want, to be present at birth. It was very important to the hospital to have that kind of policy. Well, in the last couple of weeks, we've seen that policy with regard to visitors completely change, so that no one is allowed to accompany a patient even if they were in emergency, as in they needed emergency surgery because they were in a car accident, or even for end-of-life care, that is now being restricted on a case-by-case basis, but some patients may not even have anyone with them at the end of their life. Labor and delivery is now restricted to one visitor, but we know that it's actually possible that one visitor may end up being cut to 0 visitors, as in the case of New York City, which I just have to say, as someone who is about to give birth, it is a frightening time, but also kind of unimaginable to me. If you had said this to me 3 months ago, that I might have to give birth with no support system in the room and my husband on an iPad somewhere else. And so I say all of this because the question initially was about what advice do we give to patients and clinicians. I think part of it, and I hate to say this because it's so different from our normal patient advocacy mantra, but part of it is understanding and tolerating the uncertainty of our times, that we are living in very different circumstances than we could have ever imagined. And all kinds of people are making great sacrifices. And it will feel like a significant sacrifice. If I cannot have my husband in the room during labor and delivery, it will not feel great. But I know that other people are going through far greater sacrifices to be there. And we can think of other methods to increase and amplify our patient advocacy voice. We can write things down in advance. We can talk to a nurse and have the nurse or social worker or somebody else who's in the room be our advocate. This is not the way that it's supposed to be. But I think at this time we have to recognize that we are in this together and that we have to give each other a huge element of grace as we process these times of uncertainty together.
That's very well said. An element of grace, I think, something we could all use, that's for sure. Well, I'd like to open it up to our audience to ask some questions. So if you are on the web version, you can raise your hand by hovering your cursor over the over the slides and selecting the raised hand option, and I will call on you when it's your turn. You can also type your question in the chat box under participant feedback, and I can read those questions off or call on you to do the question yourself. And if you're on the phone, we'll open it up to you first, since I don't have anybody with their hand raised or any questions in the chat box yet. So we'll open it up to the phone. You can hit *7 on your phone to unmute your line and ask your question. And when you're done, hit *6 on your phone to mute yourself again.
My name is Dorothy Winningham, and I'm on the call. And I am a patient advocate, but I'm concerned because a lot of family members and my patients have kidney disease where they get, they have to be dialyzed. What can they do from their end to ensure that they're getting being safely dialyzed?
That's a great question, and I appreciate it because patients who are on dialysis certainly have at least one significant underlying medical condition that could make them more susceptible to having severe symptoms of COVID-19. And so I understand the concern, and especially I would imagine that many dialysis centers are also changing their protocols and processes too. So two things. One is for your patients, ask them to ask their dialysis center for the protocols that they now have in place, understanding that these protocols and guidelines are changing on a regular basis. But every healthcare facility should have different protocols now than they did before, than they did a month ago, for how they are protecting their patients. Perhaps these are protocols that limit the number of visitors. Perhaps these are protocols to wipe down things even more, or certain types of infection control protocols. But I think it is important to know what these protocols are. The second is to follow good hygiene practices yourself for all of us, which I know is something that we keep on talking about, but I also think it's what we can do. I mean, so much of COVID-19 feels like it's out of our hands, that this is a virus, and it's easy, I think, to feel powerless. But actually, we are not powerless against this virus. There are steps that we can each be taking, and that includes really good hand and face hygiene ourselves.
Okay, great. Thanks, Dr. Wen.
Thank
Do we
you.
have another question from the phone? All right, thank you for your question. We can take another question from the phone now.
Hi, Jonathan. This is John Shaw.
Hi, John.
And hi. Part of the question I had for Dr. Wen is, what can we do in broader terms? You mentioned a few things that this is likely to impact the most vulnerable, that we've got to understand and tolerate the uncertainty better in the patient population. But some of the tools that we would normally use to focus efforts don't exist because we're not testing, which you also mentioned. Mm-hmm. And so that would seem to be one of the biggest interventions that can provide a lot more information, particularly when we're seeing initial analysis of the China data that maybe close to 80% of transmission was in asymptomatic patients. So we really need to start placing some of our testing capacity into surveillance testing to be able to take the general population and divide it up into finding who are really the most vulnerable for the COVID interventions. So what are the risk factors for population density, access to care, houses of worship, those that are living paycheck to paycheck, all the things that we think are going to be major factors and affect populations differentially. But we don't know yet for coronavirus until we actually come up with measuring the data versus anecdotes. Any solutions?
I think you are articulating many of the problems very well about the situation that we're facing. If I were to name the three things, if I had my way and had the policy prescriptions that I would that I would advocate for, here are the three. The first and the most urgent is to shore up our healthcare capacity, because we are facing the untenable situation that we've seen in other countries. We know it's coming. It's now in New York. It's soon going to be hitting Michigan, Louisiana, Massachusetts. I mean, and we don't even know how many other hot spots are just around the corner. We need urgently to have materials. I mean, we need people, we need beds, we need supplies, and we need that urgently. And that can't be a reactive response, because if it is, then we're always going to be behind. We're going to wait until people die before we start shoring up capacity, which doesn't make any sense at all. So that's the first part, is that we need to urgently get our healthcare system ready, which we should have done already, but we're not there. So that's the first thing. The second thing, I completely agree with you about widespread testing. It should not just be testing individuals with symptoms for all the reasons that you mentioned very well, that there are many people who are likely to be asymptomatic carriers who are spreading it in the community and don't even know that they are. And so having that widespread testing for anyone who wants it and needs it, and to have surveillance testing, is really critical. I would place that. It's hard to say that this should be, it's not like 1, 2, 3 are numbered in order of priority, because these are kind of equally important, but we do also need to prevent people from dying at the same time that we're doing testing as well. The third component that's, I think, also critical is for all of us to practice social distancing. That's the best tool that we have to reduce the rate of transmission in the community. That's the best tool that we have for reducing this onslaught of cases all at the same time that will overburden our healthcare system. And so that's the other component that I just wanted to mention too, that's the component of, here are the steps that each of us can be taking. And when I hear from the White House and from others who are suggesting that somehow we can roll back the social distancing measures, which is step number 3, well, we cannot unless we get these other 2 fixed first. If we are able to have our hospitals so that they can treat patients and actually have an accurate count of the number of people who are infected and could be transmitting it, then we could consider rolling back the social distancing measures. But until then, that is our most powerful tool, and that's what I would focus on.
Good.
Thank you for your question, John. Do we have another question on the phone? Remember that you have to hit *7 on your phone if you want to speak.
Hello. Can you hear me?
Hello. Yes, Kim.
Yes. So my name is Desiree Bradley, and I am a patient advocate, family advisor. And my question is, I'm in the Houston area, and we have a very diverse population and a lot of language barriers. And so any tips or strategies to really engage those populations where there's language barriers, especially since we talked about those most at social risk, because my fear in my own community is that the messaging is lost because they're not quite understanding what is going on and how to deal with that. So any strategies around that?
It's a really good question, and I think that this just goes along with the most vulnerable population concern, that I do worry about people who already face a lot of barriers to care, whether they are economic barriers or fear of immigration rules or language barriers or cultural barriers and others. And I don't have a good solution here except to say that we need far more support services for translation, for cultural competence, for getting accurate information out, because that's another component that I'm increasingly concerned about, is that there is a lot of misinformation, a lot of fraud, and I would really fear for those who are at increased risk for being exploited, including those who have additional barriers. And so I think anything that could be done in the community that bolsters the community voice, as in if there are trusted messengers, community groups that are really good advocates for patients, those groups should ideally do even more and ideally have more funding available because they are the most trusted messengers, credible messengers to their communities.
Thank you. I appreciate that.
Thank you for your question. All right, do we have another question on the phone?
Hi, can you hear me?
Yes.
My name is Rick Westfall. I'm calling from Cleveland, Ohio, and I work to educate a bunch of human resource benefit administrators at my organization. When I think about, a lot of people out of work, and I think about a lot of people working remotely that don't necessarily have, a public health or any kind of health background from an education standpoint, what's the simplest language we can deliver to such an audience to kind of enforce, that, the country really needs a little bit more time with social distancing to prep the hospital systems and until testing gets out there?
I mean, I think the way that you framed it is exactly right. I think whatever message we send needs to send a message of alarm and seriousness because this is a very serious situation. We are facing a situation where 40% perhaps of the American population could be infected and millions could die. Right? I mean, that is a very serious situation that we have on our hands. But we also should stress that this is not a hopeless situation and that there is something each of us can do, that protecting yourself and protecting your family is also what is going to protect society. So stay indoors, do not go outside, do not interact with people who are outside of your family unit unless you absolutely have to. If you're going outside to take a walk, fine, but don't stand around other people. I think give people the understanding of why they need to separate from others physically is important at this time.
All right, we've got time for just one more question. Do we have any takers on the phone? So I have one that I'll just throw out there to wrap things up, and that is
again. I'd like to get the name of the book that Dr. Wen has written.
That's very kind. So my book is When Doctors Don't Listen.
Sorry,
How to avoid
Say again.
It's called When Doctors Don't Listen.
Okay.
How to Avoid Misdiagnoses and Unnecessary Tests. And I think it was in the email that Jonathan had initially sent out. But I very much appreciate that. And I am going to have to jump off in a couple of minutes. But I just, in case we don't have time to say the closing words, I do want to just wish everyone really well. Because it is a challenging time for all of us. It's a challenging time where we're all called upon to do things that we might not have imagined doing. And it's a time where we all have to step up in ways that we might not have imagined before. And so I do hope that I know everyone will do our part, and I hope everyone stays safe and well, too, in all of this.
Thanks, Dr. Wen. Thank you very much for taking the time to share with our community your perspectives on COVID-19. For all those of you who joined us today, we hope this information was informative. We know that many of you are on the front lines of the response, and we're grateful for your leadership and action. Please be on the lookout for a brief survey about today's program. If you could take just 60 seconds to give us your feedback, we would appreciate it. I also encourage everyone to tap into our amazing community of healthcare quality leaders as we navigate these challenges together. We have an active conversation underway on our online community, Member Connect, and the recording of this program will be posted there shortly, so be on the lookout for that. Thank you again, Dr. Wen. This concludes our program, and on behalf of everyone at NQF, we wish you continued good health amidst this pandemic.